Well, good afternoon, everybody, and welcome to this Wellbeing and Relationships Roundtable. My name's Claire Tyler. I'm a working peer in the House of Lords, and I'm just going to do a few introductions. The long title, which I think is a rather wonderful title to today's roundtable, is Putting a Price on Love, Valuing Wellbeing and Relationships in Social Policy. And it's organised today by Tavistock Relationships in association with the What Works Centre for Wellbeing and Bono Economics. First of all, just a couple of housekeeping things, please. First, to say that we are being recorded. The second is to say, could I ask everyone to mute yourself and to keep muting unless you are actually speaking, and that applies to the actual speakers themselves as well. And when we do get to the discussion session, could I ask people if they could use the raise hand function, because it's easier for me then to see who wants to come in, and to unmute yourself when I call you. So just very briefly, I just want to say that I'm absolutely delighted to be chairing this roundtable because it sort of brings together two of my favourite policy interests. The first one is all about relationships, relationship support, the importance of relationships in social policy, and that's an interest I brought with me from my time as CEO of Relate into my work in the Lords. And the second is around wellbeing economics. I've been a sort of either chair or vice chair of the all-party group on wellbeing economics for quite a few years now. So today's roundtable really sort of brings together these two interests of mine, looking into the importance of family and personal relationships and wider wellbeing in public policy, and obviously particularly social policy. And the final thing I wanted to say is I think it's very timely that we're having this event today. The all-party group on wellbeing, we called last year for wellbeing to be put at the heart of the spending review. And of course, on the eve of the comprehensive spending review being announced, the Treasury published its wellbeing guidance for appraisal, which builds on extensive wellbeing research over the last 20 years and offers a sort of step-by-step approach to incorporate wellbeing evidence into all aspects of policy making. So we haven't got, I think it's the 27th of October when we're going to hear the outcome. So we haven't got long to wait now to see if this has made a difference to the outcome of the spending review. So I'm now just going to very briefly introduce our panel, and I must say it is a very illustrious panel. I think we're very lucky to have our four speakers. We have Dr. Allan Little, who is Head of Economic Appraisal at the Department of Education and working in a personal capacity for Tavistock Relationships. We have Andrew Balfour, who is the CEO of Tavistock Relationships. It's been my pleasure to work with Andrew for a number of years now. We have Nancy Hay, who really is a sort of a world-leading expert in the field of wellbeing. In 2014, she set up the What Works Centre for Wellbeing. And again, it's been my pleasure to work for Nancy for a number of years now. And we also have Jon Franklin, who is Chief Economist at Bono Economics. So having made those introductions, could I please now hand over to our first speaker, Dr. Allan Little, and all speakers have 10 minutes, please.
Thank you very much. As I said, great introduction. I'm kind of wearing three hats today, just to kind of introduce myself. So the first hat is as a new parent. So I have a 4-month-old next door, so apologies if he chooses to join in the conversation. He's very chatty today. My second hat is as a member of the Government Economic Service. And a co-author of the new Treasury guidance on wellbeing appraisal. And my third hat is working in a personal capacity for Tavistock Relationships on this case study. So I think my role in this discussion is to kind of tee up the rest of the conversation by providing a kind of overview of that case study. So it's based on an intervention within the Reducing Parental Conflict programme, which is delivered by Tavistock Relationships. And we looked at a specific intervention, which is mentalization-based therapy. And we know from the evaluation evidence for that intervention that it has significant improvements both on relationship quality for parents that are kind of suffering from relationship difficulties and high levels of conflict. And it also reduces kind of problems with mental health for those parents as well. So that's what we knew from the evaluation. Tavistock Relationships involved me to answer a kind of secondary question, which is, well, what's the value for money of this intervention and how can we go about assessing that? And I think that's where wellbeing economics comes into its own, because I think firstly, all economics is probably founded on that idea of trying to kind of maximize well-being in some way with limited resources. We might refer to it as social welfare or utility, but essentially it's well-being. But if that's the principles of economics, and I think in practice, and many of you will have experience of this, when we start to develop our cost-benefit models, they can look a lot more like a financial balance sheet. And the things that we might focus more on are parts of the productive economy, so GDP, income, and expenditure. And at times we can overlook the inherent value of relationships and well-being in our lives. So well-being economics is in essence a way to try and kind of bring those things into our cost-benefit model. So I will move on to the next slide. This is as technical as this presentation is going to get. But if well-being is what matters, then the next question is, well, what can we measure and what could we potentially monetize within our economic models? And our starting point for this is the Office for National Statistics subjective well-being measure. Overall, how satisfied are you with your life nowadays? And that's on a 0 to 10 scale, 0 being not at all and 10 being completely satisfied. And our economic metric is essentially a 1-point change in that scale for a period of 1 year, and that's known as one well-be or well-being adjusted life year. So we can use these metrics to incorporate those within our CBA. There is a further step that we might need to take if we want to kind of include that within a cost-benefit analysis, which is to place a monetary value on those well-be's. Now, the reason we might want to do this is mainly for comparison. Firstly, for comparison to the cost of the intervention, which is already in money terms. And secondly, because a range of different interventions will be appraised through the spending review in those standard cost-benefit metrics. So they're usually in money, it's benefit cost ratios, and it's net present values. So in the new Treasury Guide, we recommend a kind of well-being value of between £10,000 and £16,000. 10,000 aims to be kind of roughly consistent with other health metrics that are used across government. So mainly the quality adjusted life years. That's another metric that's predominantly used by the Department for Health and Social Care and the National Institute for Clinical Excellence. The higher end of our scale there, the £16,000 estimate, aims to be kind of approximate to a range of evidence on the link between income and well-being in the well-being research. So I can go into this in more detail, but I'll perhaps kind of leave it there. The key point is that in this presentation, the next few minutes, we probably can't settle the philosophical debate about how to value well-being, or even if we should put monetary values on this at all. But the key is that we now have some values that at a practical level we can start to implement. Now, for the mentalization-based therapy intervention, we don't actually measure life satisfaction directly at the present time. Now, Tavistock Relationships do intend to measure that in future evaluations. So we needed to look at other ways that we could get a handle on how much life satisfaction might have improved. And the main metric that we can observe within the evaluation is a reduction in clinical levels of depression for parents. Now, there's a separate framework that's been developed by the Centre of Economic Performance by Lord Layard et al., which puts a kind of well-being value on that clinical depression of 1.5 well-be's. And that's based on the average population difference in life satisfaction between the clinically depressed population and those who aren't. So we're adopting that value too. It's cost-benefit analysis, so there's a range of other evidence and assumptions lying behind this. Some are taken from the evaluation itself, some from secondary sources. So very briefly, the cost of the intervention was 1.2 million in the Hertfordshire contract area, and that's to 579 parents. The impact in terms of parents moving out of clinical depression, we estimate to be between 51 and 114 parents. There's some missing data in the evaluation, which is why that's in the range. We have our wellbeing benefits per year and per parent for those that are moving out of clinical depression. We estimate that's between 15 and 25,000 based on those values that I've just shown. And we also have a fiscal saving. So this is from evidence from the King's Fund that suggests that the average public cost associated with delivering support for mental illness is around about £1,100 per annum. The other assumptions that we need to make are around duration. So we can't observe for those parents that do move out of a kind of clinically depressed state, what's going to happen over the next 10 years. So that's in the future, we can't observe it now. So we estimate that with uncertainty, and we do sensitivity analysis around that. But we think there is good kind of prior evidence from elsewhere that MBT and relationship support do have sustained effects on rates of depression. And similarly, there's no real cause to think that the outcomes are not attributable directly to the intervention, but we look at some sensitivity analysis around that. And we also adjust for optimism bias, which the Treasury suggests we should always do within cost-benefit analysis. So that's our assumptions. I'm just going to very briefly show the conclusion of the report through our benefit cost ratios. So we have a range of scenarios here which run from low to high and suggest that the return per pound invested in the intervention could be between around about £5 up to £17. And just to give a very brief benchmark as to whether that's considered a good rate of return, that's quite a subjective view in a way, but the Department for Transport do publish their benefit cost ratios. And they would suggest that a return above 4 to 1 is considered to be a very high rate of return, and about 10% of transport investments would see that kind of return. So in other words, the benefit cost ratios are quite high. Moving on, we need to bear in mind that what we can monetize here, which is denoted by the stars in this table, is not all of the benefits. So there's a range of different benefits that we're not picking up, both for parents, for children, and parents do report that the children's well-being has improved as well, and for wider society. So we need to keep in mind that there's still quite a lot missing, if you like, from our economic model. Very briefly, sorry, the slide skipped on a little bit, but we do some break-even analysis around the impacts on children. So whilst we don't include this in the main cost-benefit analysis, there is some indicative evidence that children that move out of a diagnosable state of mental illness, we might see a cost reduction of £260,000, and that kind of relates to a range of different benefits relating to mental health service provision, lifetime earnings, etc. So actually, it wouldn't take much, many children moving out of that diagnosable state to potentially offset the cost. Is the analysis that we have here. So that's it from me, just to kind of tee up the discussion, really. So thank you for your time, and if you'd like to get in touch around the Wellbeing Guide the Treasury's produced or this particular report, then feel free to get in touch. Thank you.
Thank you so much for that, Alan. That was really great, and I think really helps to set the scene for our discussions today. And also thank you for sticking to time. I'm now going to hand immediately over to Andrew Balfour. Andrew, you need to unmute yourself.
There we are. Can you hear me now? Yeah, great. Okay. Well, first to say, we're so grateful to Alan for his excellent report. And, In terms of the background to this, whilst we know from basic research that frequent, intense and poorly resolved conflict between parents can place children at risk of mental health issues, behavioural, social, academic problems, it's really helpful that we can, as a result of Allan's analysis, begin to quantify the economic benefits and impacts of work which seeks to reduce children's exposure to parental conflict. And what more crucial time could there be to invest in this kind of work? A YouGov survey we commissioned this summer painted a disturbing picture of the state of couples and families in post-pandemic Britain. For example, 4 out of 10 respondents in our survey felt that the experience of lockdown would have long-term impacts on their mental health, and a similar number said that the pandemic caused additional stress for their children and wider family. It's especially concerning that separated parents have particularly struggled, with 68% of them saying that the pandemic had caused significant additional family difficulty. So overall, the impact of the pandemic on parents has been stark. 14% reporting that the experience of lockdown led them to consider splitting up. Parents being twice as likely as couples without children to reach this point. The stress of the pandemic has led to increased conflict and difficulty in our couple relationships more generally, and in many cases resulted in relationships being at their worst point ever or breaking up. Around a quarter of all respondents felt that the pandemic had caused increased stress and conflict in their relationships, and half of those felt that they were at their worst point ever. Now, I think if we think about it, this just isn't surprising. Families have had to bear the emotional strain as we've all been cut off during the period of lockdown from the outside world of wider social contexts. And in my clinical work, I've seen many couples where fault lines in their relationship, which previously have held, have been blown apart by the pandemic and its mix of heightened anxiety, along with the removal of external structures and social supports. For many of us, the pandemic has meant that we have been reliant on our family relationships for really most of our support. And where there have been underlying vulnerabilities in these relationships, I think these have inevitably become amplified. Overall, the message from this YouGov survey of more than 2,000 people across the UK was clear. Family relationships are under strain, and people believe that couple and family relationships need support now, just as our mental health does. And I think this is important. I think never before has the link between our relationships and our mental health been so evident to all of us, as the experience of the pandemic has brought home what research has long shown. In many respects, relationship health is mental health. When relationships are in trouble, our mental health suffers. And we know that relationship support can significantly improve mental health. The title of today's event is Putting a Price on Love, Valuing Wellbeing and Relationships in Social Policy, which suggests perhaps, sorry, can you hear me okay? It seems to be a lot of feedback.
Can I just come in to say, we seem to have quite a lot of background noise. Could everyone check they are muted, please?
Okay, I'll just step there. So today's event is called Putting a Price on Love, Valuing Wellbeing and Relationships in Social Policy, which suggests perhaps that we don't currently value those things sufficiently enough. So I'd like just to spend a few minutes now setting out some key areas of health and social policy where we have opportunities to value well-being and relationships more than we do. The first is divorce. With the implementation of the Divorce Act due next year, we have the chance to reframe divorce, not simply as a technical legal matter, but more fully acknowledging that divorce and separation are psychological events, journeys even, which, as the Reducing Parental Conflict programme shows, are amenable to interventions which are aimed not at keeping relationships together at all costs, but helping couples who are separating or separated and co-parenting to do so in such a way as to improve adult and child mental health and well-being. In fact, our data from the Reducing Parental Conflict programme shows that outcomes in terms of mental health and conflict between parents and with children are just as positive for separated as for intact couples. And then there's the family court, or the pre-court space, as it is sometimes called. The Ministry of Justice is currently working in North Wales and Dorset on what they're calling Pathfinder pilots to introduce and evaluate a system around the family courts to help support those separating parents, and there are many, who currently gravitate towards the court, but who could be receiving support elsewhere, for what may be chiefly relationship issues rather than legal ones. And of course, relationships play a significant and under-acknowledged role in relation to a number of health and public health issues. Take obesity. Research shows that people with improved relationships post-weight loss surgery lose significantly more weight than those in poorer quality relationships. And the extent to which their partners embrace new weight loss management rules and patterns has a considerable influence on weight loss, post-weight loss outcomes. Or cardiovascular health. Research shows that people in high satisfaction relationships are more than 3 times as likely to be alive 15 years after coronary artery bypass as those reporting low marital satisfaction. And this could prompt us to explore whether post-operative relationship support intervention can boost well-being and help people live longer, happier lives. Similarly, studies show that blood pressure and ventricle mass are related to the quality of marital satisfaction. And we could explore light touch support as a way of reducing the numbers of people experiencing strokes or other cardiovascular events. And now coming to mental health and well-being. We know that focusing on relationship works in the context of depression. Couple therapy for depression is year on year one of the highest performing talking therapies delivered by the NHS in terms of recovery from depression and anxiety. And we're confident that couple therapy for alcohol dependence, which follows a similar evidence-based methodology as couple therapy for depression, can help reduce alcohol dependence by strengthening the relationship of the couple. Indeed, we recently ran a DOH and DWP funded pilot to train practitioners in this approach. And there are many other examples where the research evidence is clear, whether our relationships are same or opposite sex, whether couples are living together or separated. The qualities of our relationships are of the greatest importance in a wide range of public health outcomes, from our earliest years, the emotional, cognitive, and physical development of children, to the end of our lives, in old age affecting the likelihood of hospitalization, the rate of progression of disease and dementia, and even mortality rates. To return to Alan's report and the Reducing Parental Conflict Programme, the fact that the DWP took the initiative and published the evidence base, then funded a large-scale pilot of approaches aiming to reduce conflict between parents, offers a template for how government can listen to research and use it to back innovation in order to address deep-rooted problems in our society and reach people who are most in need. Going forwards, as we start to emerge from the pandemic, the need for support for couples and families is greater than ever. For the government's levelling up agenda to have lasting and meaningful results, we must support the relationships and mental health of all families, particularly those who have suffered differentially badly as a result of the pandemic, as our most vulnerable families have become more disadvantaged than ever. The wellbeing framework that Alan's report draws on offers us a really important platform in terms of new ways of representing the public health benefits, which we can see clinically, but which now can be captured in economic terms. And I very much hope that Alan's report will pave the way for a relationships and wellbeing lens to be applied to the economic evaluation of many areas of social policy intervention in the future. Thank you.
Thank you very much for that, Andrew. We're sort of halfway through our presentations now, and I think it's been really interesting to hear about the wellbeing framework developed for the Reducing Parental Conflict Programme, and also, Andrew, from you, so many examples of such important areas of social policy that relationships are frankly fundamental to. So before we move on to our next 2 speakers, we've got a short slot for any quick questions and comments for Andrew or for Alan. Could you please raise your hand virtually? There's the icon at the bottom of the screen if you'd like to come in. And I can see that Andrew Salu, it's great to have you with us, Andrew, has got his hand raised. So Andrew, would you like to unmute yourself and come in?
Yes, thank you very much, Claire. Great presentations. I mean, incredibly powerful data that we've got to get out there more widely. So my point is that when there is talk about building back better and levelling up, relationship quality needs to be at the heart of this, strengthening the couple relationship. And it is absent from the political debate at the moment. So my challenge to all of you is to get together, ramp up the noise, find the language, and give politicians like me, you know, the sort of the phrases and the points which we can use again and again in debate, and Claire in the Lords, just to get this taken on board. It is so important, but there's no good, you know, I think we're all converts here. We're sort of, you know, preaching to the choir a bit, aren't we? There are lots of people out there who sort of don't get it. So we need to get together, raise the temperature, building back better, levelling up. You know, what we're talking about needs to be at the heart of those two agendas, and I don't see that it is quite yet.
Thanks for that, Andrew. It's a really important point. Would either Andrew or Alan or either of our two other speakers like to come back with any quick response on that? Andrew, can you please unmute? Yes,
I'm muted. Sorry, that's the biggest problem. Just thank you for that, Andrew. I mean, absolutely concur. I mean, I'm very aware that I'm preaching mostly to the converted probably here this afternoon. We're doing what we can, and of course it is a critical time. You know, DWP has taken such an innovative approach over the last 3 or 4 years, and with this comprehensive spending review, really the future of all this work hangs in the balance. So we are doing what we can. There's the Sorted Out campaign that the APPG that you chair is driving forwards. But any ideas that anybody has here this afternoon that, you know, to guide us about what we can do to ramp up the noise, as Andrew says, be very gratefully received.
Thanks. Yes, Alan, I can see you've got your hand up.
It's just a really quick one. I mean, I think there are some language barriers and some kind of terminology barriers. And I think just another reflection on the work that we've done here, it is at the technical end, you know, it's a cost-benefit analysis. But in terms of the wellbeing guide itself, that is looking at a range of different ways that we could incorporate wellbeing at all stages in the policy cycle. So it doesn't have to be necessarily in that slightly more technical end that I kind of operate in. So yeah, I'll stop there.
And Alan, I did see in your report that you did actually put in a short section about levelling up and relationships, and particularly drawing attention to the sort of the disparities, if you like, between more disadvantaged areas and levels of sort of relationship distress, and particularly sort of poor mental well-being for children. So I think that point was recognised. But Andrew, can I slightly throw it back on you? Because I think it's an excellent point you raised, but certainly in some of the other areas of work I'm doing, sometimes getting some of your colleagues to understand that levelling up is about more than sort of building roads and bridges and buildings, frankly, hasn't been that easy. I mean, I've been trying with another hat on to talk about the importance of education and health facilities. I haven't actually tried to go in on relationships, but have you got any advice yourself about how we can get some of your colleagues a bit more understanding of this?
Yes. I mean, Claire, you and I may be in different parties, but we're joined at the hip on this issue, and I couldn't agree with you more. Yeah, I mean, I guess I was partly saying it to myself, but politicians like me need the help of the professionals and the people who've got the research there, and, you know, clever people who can think of the language. We've just got to get it into the debates. You know, we've just got to all keep talking about it, and could talk about it ad nauseam. There's no good releasing one report or saying it once. I mean, the rule in politics is only when you've said something about 500 times that anyone's vaguely heard it. You know, so we have to be saying this stuff till literally, you know, we are virtually going mad saying to it because we can't believe that everyone in the country hasn't heard, but they actually won't have done. So, I mean, number one, endless repetition. But, you know, just these bullet point facts. I mean, what I would love is one sheet of A4 with the key reasons why this matters, that we can try and maybe get out to every MP. So how's that for a concrete suggestion? But, you know, the fact you're 3 times more likely to be alive after cardiovascular surgery if you're in a high satisfaction relationship is pretty important, isn't it? You know, now, even if you don't care about these issues, you know, you will do in terms of your survival rate. So, you know, give us the facts, give us the really interesting bullet points, the ones that will have cut through, that will relate to, you know, our constituents up and down the country. That's what I would say. And, you know, I mean, I'll put in for Westminster Hall debate on this, but, you know, it needs to be every week in the chamber, business questions, short questions in the Lords. You know, it's just got to be a drumbeat, hasn't it, all the time. Eventually people will hear us and they'll act.
Thanks, Andrew. I thought that was a really excellent response and a very constructive suggestion, I think, about your one pager. I think Samantha wants to come in. Samantha, would you like to unmute yourself?
Hi, yes, sure. Sorry, I don't have great internet when I use Zoom, so I'm going to leave my camera off in the hopes of making that better. But I am really on board and agree with the movement to try and put well-being at the heart of policymaking and at the heart of the spending review, etc. But I imagine and expect pushback to come from the fact that we are defining well-being maybe in a way that I would consider quite narrow, so focusing on kind of like love and relationships, whereas, as has already been mentioned in this conversation, well-being really refers to or interacts with a wider range of issues in our lives, things like employment and those measures that we as economists or as policymakers tend to call kind of like harder measures or hard economic indicators, unemployment rate, etc. And I'm wondering if there's any scope in the future to expand our definition of well-being, because I think at least that might help get more people on board with making it central to policy making, is if it had a sort of wider definition.
Thanks very much for that, Samantha. And I just wanted actually, Nancy, I know you haven't had your speaking slot yet, but this is so much your sort of area. I just wondered if you wanted to respond on that point briefly.
Thank you. It's a great question. And yeah, I'll talk a bit about this in a minute. But when we're talking about, it's actually Andrew's point about people never heard about this stuff. The biggest consultation the ONS ever did was about the wellbeing framework for the UK. It reached 60,000 people. It was massive by public sector consultation standards, but no one's heard of it. But they talk about ONS wellbeing being how we're doing as individuals, communities, and as a nation, and how sustainable that is for the future. So this is a broader understanding of our national accounts. So not just economic, but social and environmental as well. And this is it also what's happening internationally in terms of what's happening at the OECD in terms of their Better Life Index and the concepts of capitals and how you bring that all together to look holistically at how we're doing. And so that's exactly what I'm talking about when I'm talking about well-being. And then I'll help explain why relationships matter so much within that and how we can understand how we value that. But that's exactly what we're talking about or I'm talking about when I'm talking about well-being. So at a personal level, it's about feeling good and functioning well. At a national level, it's how we're doing and how sustainable that is for the future.
Thanks very much, Nancy. I can't see any other hands up immediately, and we are on a very tight time schedule. So I'm going to suggest we now move on to, actually, Nancy, to your main slot. And I know you're going to talk about valuing family and relationships in policy more broadly. So over to you.
I'm going to share a screen and say hello. So I'm Nancy Hay. I'm the director at the What Works Centre for Wellbeing. It's brilliant that we've got you all here on the call today to talk about relationships and how it fits with wellbeing, and particularly some of this quite technical stuff that Alan's been talking about, but why it really matters. There is no department for relationships. There's no department for the family. We can't legislate very easily for love, and the state really struggles with where family policy sits. And I mean, for example, the DWP is involved in this. There's a family test. It's very, very specific, and it's very difficult to get these cross-government things in. We're not the only nation thinking about this, and it's also not just the state's job. It's also about our communities, our families themselves, and our organisations, our businesses. So we also work with employers as well, and the comments around the Divorce Act was interesting. Really, we often talk about how we employ staff in terms of how we technically get somebody into a job and pay them. We often very rarely talk about how we manage them, and how relationship breakup is often linked to mid-career challenges in the workplace as well. So I think it's a very wide audience for this, not just the state, but communities, charities, businesses as well, and families too. So here is my discussion today. So I'm just going to, sorry, I've got too many things open. Here we go. So we're talking about the valuation of relationships, about the wider context. So I mentioned a little bit about this definition of well-being. So when we're talking about public policy, we're aiming to improve people's lives. And so what is it we're trying to improve? People travel around the world, across town, to get a better life. What is it that means? So in the OECD, they have a broader approach called the Better Life Index to helping us understand what it means to live well where you are. And you can put in what's important to you and see which places match up. So, and they're across the whole of the OECD, trying to really shift how we understand what a good life is and how we measure it and how we act to improve policy. We have a UK national measures of wellbeing, and my cat Haynes is coming to join us. And they include subjective wellbeing, but they also include metrics on relationships. And I was wondering how many had heard about this. We've had this for 10 years. But these are the relationship measures that we monitor regularly: unhappy relationships, loneliness that we also work on, and really importantly, having someone to rely on in times of trouble, whether that's having a trusted adult or a friend, is a real key indicator of a high well-being nation. So these are really important metrics for how we're doing collectively, and often hidden. So it's called our hidden wealth. We think the purpose of all of government policy and of civil society action is to improve lives. The question is, does it? And how do we know? And we can look objectively about whether people have a house, etc., and how they're all the making things. We don't actually know how we're doing, and so we ask. And because we're British, we ask twice, and people say they're fine. We ask again. But we ask regularly, and we've been asking regularly since 2011-12. And this is broadly how, on average, it's been going from 2011-12 to 2018-19-20. And we've seen also that there are big variations in well-being within places and across the country. And you can see that in the map on the left of the screen, where you may want to level up those darker places which are happier with the ones that are less happy as well. So that's what I'm talking about when we're leveling up. We're talking about reducing well-being inequality and improving quality of life. We can see that trend from 2011-12 to 2018-19. Suddenly we hit the pandemic and those measures went all over. A dotted line in the middle, you can see this is the subjective well-being, so how we're feeling of our life overall. And you can see that we're recovering to pre-pandemic levels, but not quite. The only one that's got back above pre-pandemic levels is happiness. So positive emotion. Fear has dropped right off and it's down there in anxiety. But this is just, of course, an average, and there'll be big variations within that. And that variations is where leveling up becomes so relevant. So the technical stuff and what we can do with this data. So Alan mentioned the Treasury's Green Book, and this is the guidance that officials can use to develop policy advice. So we've got that data bank of policy advice in the wellbeing framework. We've now got that shared evidence base. We can then use the Green Book to understand all of the significant costs and benefits that affect the welfare and well-being of the population, not just market effects. And this is important, and it also is important that it applies to the entire population, not just tax bases, which means children and young people too. But here we're looking at adults particularly. There's also there's more detailed guidance in this valuation of wellbeing guidance, and also the schools policy appraisal guidance for use in the education context. Now, Alan talked about the wellbeing guidance being used obviously in the technical respect. It's useful across the whole of policy making. So are we thinking about what to do, what we know and what we learn? Look at the strategic stage. What are we trying to achieve? So what are the goals we're trying to get? A happier, healthy nation. Well, the happier is partly to do with our relationships. In terms of choosing options in long list, the technical bit in chapter 4 about that analysis and appraisal, which we were talking about today, and then monitoring and evaluation. And I'll talk a little bit about that. Anna's put in there about the measures that they're using. But what we're trying to be able to do is value these non-monetized impacts robustly, consistently, and with confidence across all stages of public policy. And this is really exciting, I think. What we can see, though, is that our overall well-being is affected by things in more or less different ways. It's affected by our personal relationships, our health, our social connections. It's affected by our basic needs and the context in which we live, and our work, really importantly. And unemployment is particular. So furlough, for example, will have helped mitigate some of those effects, for example, of the impacts of unemployment. And you can see the circle on the right-hand side about the importance of partner relationships. That's consistently in the top 3 adult drivers of subjective well-being. So it's super important. We can also see the objective benefits of these, and they were talked about a bit about before. So if you have higher well-being, there's a whole lot of other things that happen in relation to health, work and social connection. If you want to look at that, we can share that. But I'm interested in improving well-being in and of its own. We talked a bit about the impact of divorce and marriage on the subject of well-being, and you can see that here. It's quite giddy, but you can see this on this awesome set of our Weldon data. Divorce is that middle one for both men and women on the left-hand side, and you can see that before that relationship breaks up, that it can be particularly difficult. So that thinking about whatever the outcome of the marriage, looking at how we support people throughout that, and also particularly couples with children, where we can see that the well-being can reduce when you've got children, particularly children under 5 or teenagers. So that's a really difficult time for parents themselves. Happiness, though, is social. So a large amount of it is our mental and physical health, but the relationships are as important for an individual and community well-being. So having a partner is as good for you as being made unemployed is bad for you. The difference, I think, is that unemployment can have a longer lasting effect, and the state can more easily intervene on that. But job-rich recovery, super important. And that's important because there are spillover effects from employment to relationships to the spouse as well. On a national level, social support is a big factor of explaining variation. And in communities, that can affect and protect people from the effect of shocks. We've seen a national collective resilience on a scale I would never have expected or wanted to see. But we saw that people came together to respond, and you can see that in the number of close friends on the right. So we're looking to act where there are a few comparison effects, where adaptation is less, and we have a safety net. And that takes us to employment, mental health, and loneliness. And I would probably add relationships within that, partner relationships, but I haven't worked out quite how the state gets involved here. And I think that's because it's not just the state's job, it's civil society, businesses, and communities. Who has the lowest well-being? Single, widowed, divorced or separated is way up there in the number of people. So we've got 500,000 people in the country with scoring under 4 or under on that question of 0 to 10, where 2 is like would rather not live. So this is quite a spectacularly serious issue in this country, where you've got single or widowed people and divorced or separated people as a large number of that group. This guidance shows us we can use it in the technical way and we can compare it. That's all that is saying, that there's a process for using well-being in this process. We've got subjective well-being data in a huge numbers of surveys. You can use it in your own surveys. It's alongside social connection measures, including personal relationships. And you can see that has been reported nationally alongside economic data, alongside the COVID data on the front page of what ONS is reporting. So this is super important stuff. What we can then do is include well-being in evaluations and scoop that back up again. And you can see that support for military families here, including parenting skills, parenting resilience and social connections, seems to improve anxiety. I would love to see a partner relationship intervention evaluated using these measures. And these are the sorts of measures we can use. But the challenge, of course, is that if we don't have those measures, and that's what Alan was doing today, was having a go at going, we didn't have them, how can we understand that impact? And that was the guidance we developed with Bono Economics to go, okay, we didn't have those measures in, what can we understand about the impact of this programme on relationships going forward? And then we can use that to understand the effectiveness of the programme in terms of the impact we were hoping to achieve, and compare it against other things that we might be able to do to improve wellbeing. And I think partner relationships will be a big part of that. Thank you very much.
Thank you very much for that, Nancy. You've covered an awful lot of ground, so probably quite a lot for people to take in. I was particularly taken with your phrase about levelling up happiness, and sort of seeing that through the lens of tackling well-being inequalities. I thought that was a really important point. So can we go straight on to our last speaker now, who is Jon Franklin, who is going to talk about the importance of well-being impacts in the social sector. Jon.
Thank you very much, and thanks for inviting me along. I mean, there was a lot of content that's already been covered here, but I guess I wanted to pick up on the fact that we are using very much a well-being lens to look at this. And that's quite new. It's not something that has been done extensively in terms of policy appraisal up to this point. But I think pro bono economics spends a lot of time working with charities and using the principles of economic analysis to help explain the impact that social sector and charity organizations are having. And we see the use of wellbeing as a huge opportunity and something that we hope is going to get picked up and used far more broadly. So whilst Alan is introducing a great fresh example using it for Tavistock, we think this should become the norm for social sector organizations. So I want to talk a little bit about why we think that. And it's going to touch on some of the points that have already come up. I'm just going to quickly share my screen. So we start off from, we do a lot of economic evaluation, and fundamentally most charities approach us for that because they want to talk about, for every pound spent, this is delivering £5 of benefit in social benefits, contributions to society, savings in government, those kinds of statements. And we don't use pounds and pence because intrinsically everyone thinks that's a great way of measuring stuff. It's because it's a common currency. It's something that everybody has roughly an understanding of what £5 benefit looks like because we're using pounds and pence on a day-to-day basis. And I think it's useful to think about where those pounds and pence benefits come from when we do this kind of economic analysis. And broadly speaking, they fall into three groups. And these have been touched on already a little bit, so I'm not going to go into lots of details, but we have the very traditional GDP style benefits. So these are things that relate to productivity, output within the kind of market bit of our economy, the bit that is traded, that we have pounds and pence prices on. So productivity in that sector of the economy. And for most evaluations, this basically boils down to getting people into work or getting people into higher wage roles. Those are the proxies that are normally used for this traditional GDP economic analysis. The second group of benefits that we see a lot are savings to public services. So interventions that help people, and that means that there is less demand for the NHS, less demand for GP appointments, those kinds of things that help to reduce the cost of the government. And there's been a particular focus on this over the last 10 years, I would say. And then there's this final group, which is about the improvements in the quality of life. And this is where wellbeing really falls in, because I think it helps to demonstrate that actually, for a lot of interventions, yes, it might get somebody into a job. Yes, it might provide some savings to the NHS, and those things are important. But particularly if you go and ask people that are working in the social sector, ask people that are working in the charity sector, why do they do it? What motivates them? What's the purpose of it? It's not about getting people into jobs. It's not about saving the NHS a bit of money. It's about fundamentally making people's lives better. And the challenge is, traditionally, and this is a gross generalization, but traditionally, economic evaluations have been very good at valuing the first two of these things. And if you look at most cost-benefit appraisals done by most government departments over the last 10, 20 years, there'll be lots in there on this stuff. It'll all be quantified. There'll be estimates around lots of these kinds of things. But they don't do very good. They don't do a very good job of capturing this third group, the impact on the quality of life. And I guess, does this matter? How much does this matter? And I think actually there's a neat example in the kind of methodology that Alan used that can help draw out why this potentially has a hugely important impact on the decisions that are made. So at the heart of Alan's analysis, we're looking at what's the impact of essentially preventing or helping people who are suffering from depression. And there are, fortunately, for this particular type of intervention, for this particular type of outcome, some estimates already out there that fall into these three broad categories. So we look at the traditional GDP benefits. What are the benefits from basically improving helping somebody to recover from depression over the space of a year? That is likely to help, on average, some people get into work, help some people move on to higher value roles, more productive roles. And this is estimated using one source here at around £5,000 per year. So that's substantial. That's meaningful benefit that has. For the savings to public services, this is probably a slightly narrow estimate of this, but in terms of the pure savings to local authorities and NHS services, it's estimated around £1,000 per year from helping somebody recover from depression or preventing them being clinically depressed in the first place. But if we use Alan's estimate, which is based on the wellbeing approach of what's the value of that improvement in the quality of life from helping somebody reach depression. So this uses that Treasury guidance, this established approach, the government's own approach that it's putting out there for valuing this type of benefit. It's coming out at around £20,000 across the year. Now, we have to be fair here, there is a risk of double counting with the way this is done, and we could debate the ins and outs of this. So let's, on the safe side, I'm going to knock £5,000 off that wellbeing value because it could overlap, particularly with that traditional GDP benefits. There is value to somebody in terms of their quality of life from helping them get into a job and the income that could generate. So there's potential overlap. But to remove any risk of that, I've safely knocked £5,000 off the scale of those benefits from improving the quality of someone's life, from those wellbeing benefits of this. But you can see, just in terms of the sheer scale of this, actually those wellbeing benefits are accounting for 70%, more than 70% of the total benefits that we might value if we chunk it up by these three different groups. So if we ignore these, it has a real fundamental impact on the judgments, on the decisions we are making as a society. And so much of what the charity sector does, what the social sector does, is focused on that quality of life element, that well-being element, that if we ignore this, we are really undervaluing what the social sector does for UK society. And that means that it gets undervalued, it gets underused, underthought about in terms of important policy decisions. So our reason is fundamentally these quality of life impacts, these well-being impacts are hugely important. And this is quite a good example, a neat example of demonstrating just how important they can be to some of these critical decisions. So the more that they are used to inform decisions, particularly in the social sector where it's such an important driver, such an important motivation for so much of what charities do, that we have to get that included. And the more we do that, the better. But I think the other reason that we think this is so important for the social sector and for organisations like Tavistock is it's actually really pragmatic in terms of an approach. There's basically two broad approaches that we've already discussed very briefly. One is that you directly measure the impact. So here, if you can build in those ONS, those key measures of well-being into the before and after type evaluations that lots of charities do, then you can start to measure that impact directly. And this is not complicated. These are publicly available questions that already exist in lots of ONS surveys, and that frankly, the ONS, the What Works Centre, everybody is encouraging organisations to build into their evaluation framework. So if you've already got one, you've got 4 ONS key subjective wellbeing questions. Actually, if you're really pushed, you might even be able to narrow that down to 1. If I was really pushed and forced to say 1 question that you have to use, that life satisfaction question, if you can incorporate that, that's a really, really powerful way of capturing these impacts. But the second approach is that indirect approach, which is the example that Alan has used, where even for organisations that haven't yet started to capture all of that life satisfaction data, if they've already got outcomes that they are capturing, then often these can be linked into wellbeing impacts, because the depth, the richness of the evidence that has been developed over particularly the last 10 years in the UK over what drives wellbeing has grown enormously. And there is great evidence, What Works Centre for Wellbeing is excellent at signposting you towards it, that can help you link the kinds of outcomes, particularly that social sector organisations are all about. They can be linked through to wellbeing impacts in the same way as Alan did for Tavistock. I think basically that's it. At a simple level, we think those wellbeing impacts, those quality of life impacts are incredibly important. We think that traditionally they've been overlooked and they might get included qualitatively, but sometimes getting them built into the numbers as well can help sway those decisions. So the more that social sector organisations such as Tavistock are using wellbeing metrics, using wellbeing measures, the more we'll be able to get better decisions made. And secondly, the fact that it's not that complicated to do, and in particular, it's a really pragmatic approach to measuring before and after comparisons for the people that social sector organisations are working with. It just seems like a no-brainer that the more social sector organisations we can get doing this, the better we're going to get, and the better the policy decisions that will get made throughout the UK.
Thanks very much indeed, John. I'm afraid we are shortly, we'll be coming towards the end of our time. I just wanted to draw people's attention to the fact there's been a very interesting conversation going on in chat. I particularly draw people's attention to the fascinating conversation about whether single people can be happy and have high well-being, and some really fascinating points being made there. And there was also a point that came up about asking from Alexandra Turner, asking whether the models that we were talking about in the first half consider the drivers of parental conflict, that the drivers of parental conflict include economic pressures, thinking about things like increased levels of child poverty. So there's some of the the points that have come up. I'm afraid we don't really have time for another full Q&A session. And the final bit was meant to be on next steps, but and I think Nancy and Jon were going to lead that. But is there, given that we've only got a couple of minutes, is there anything, Jon or Nancy, that you want to say on next steps that you haven't already?
Yeah, it was just only a couple of things. So one is that we've talked a little bit about it, is if you are doing a programme with evaluation, it is really helpful to be able to have direct wellbeing measures in there. There are two things I would say as a result, though, is that if somebody else has already done the level of research that you could do with your project, you probably don't need to do it. And focusing on how you could improve different elements of it or aspects of that will be maybe a better use of your time. So making sure that we already know what's known and building from that rather than keeping doing the same old studies. The other one I think would be is careful about this monetization, and particularly about overclaiming impact of financial. Like the idea that wellbeing impacts of X are X million pounds if you scale it up a year. Being careful about how we do that so we get realistic and robust measures that are comparable is quite important. I'd also think that we could start to get under the lid, for example, of sort of the drivers of parental conflict. So starting to understand, so if they are the drivers, what are they? How big are they? If we act on that, does that help improve this? So those are the sorts of things that would be also useful to know. And also that discussion about I'll talk about single people in a minute, but that was my next steps, was it would be great if we use direct measures of wellbeing and connection within programs and start to understand that more fully, but just be careful about overclaiming or doing research that you don't need to do.
Very much. Jon, anything that you'd like to add on next steps?
I don't think I'd add anything to what Nancy said. I think the more that organisations can think about using those direct measures of wellbeing, the better. And Nancy is absolutely right that there are always complications and difficulties around this and around overclaiming with it. But fundamentally, if you're already doing evaluations, just try using those measures because it's helpful.
Thanks for that, Jon. Did Andrew or Alan want to make any concluding points?
No, I don't think so. Just to say, we are now prospectively going forwards using those measures indeed.
Great. Alan, any concluding points from you? Right. Okay, well, I think I'm really sorry, but we are actually at the end of our allocated time now. I think it's been absolutely fascinating roundtable. There's sort of so much to take away. I just want to sort of conclude with 2 points. And yes, Andrew, I can see your point about the one pager. I think that we do need to think very carefully about how to sort of take this agenda forward and get politicians and policymakers to really, really understand it. I was very taken when Andrew went through that list of, divorce, obesity, strokes, depression, alcohol dependence, etc. How crucial they are to social policy more generally, and that's why I think Andrew's point about the other Andrew's point about can anyone. I'm going to throw this back to the organisers. Come up with a one page of sort of key bullet points that we can use when we're trying to get people who are less familiar with this debate to engage and see its importance. So I hope that we'll be able to do that, Andrew. And finally, I just wanted to say, going back to my sort of all-party group on wellbeing economics, I mean, it is great that we've now got the Treasury, having issued this guidance and saying that they are going to use wellbeing, looking at wellbeing as part of the way that they're going to be appraising the bids that came in as part of the spending review. As I said, on the 27th of October, we'll be able to see what difference that made. And I think, it will be fascinating at that point to see if that sort of looking at spending bids through that lens has made a difference or not. So maybe we can have another session at some point in the future to look at that. I think it just falls to me now to thank all of our speakers. We've had excellent speakers, and to thank those of you who have attended, who have asked questions, both orally and in the chat. I'm sorry we haven't got more time, but we haven't. So I think I need to sort of draw proceedings to a close now. So thanks very much.